The JADA system is intended to provide control and treatment of abnormal postpartum uterine bleeding or hemorrhage when conservative management is warranted. JADA uses low-level vacuum to induce a physiologic contraction of an atonic uterus. JADA is drug-free and it is not intended to apply outward pressure on the uterus. JADA provides definitive, visible, and observable control of hemorrhage and bleeding. The JADA system demonstrated effectiveness in controlling abnormal postpartum bleeding fast in a median of 3 minutes. JADA is made of soft silicone and is easy to use. The intrauterine loop evacuates blood from the uterus. The cervical seal holds a vacuum within the uterus, and a connector at the end of the tube attaches JADA to a regulated vacuum source. Upon observation of bleeding, evaluate the patient for lacerations, retained products of conception, or other causes of bleeding, and ensure that the bladder is empty. Prepare the JADA system by attaching a sterile, luer-tapered syringe to completely remove the air in the cervical seal. Remove the syringe from JADA and fill it with 60 milliliters of sterile fluid, then set it aside. Ensure visibility of the cervix and confirm dilation of 3 centimeters or more. Manually compress the intrauterine loop and insert transvaginally, avoiding excessive force. Do not grasp JADA with an instrument to facilitate intrauterine insertion. If needed, use gentle traction on the anterior cervical lip to stabilize the cervical opening. Insert JADA transvaginally, gently guiding the intrauterine loop into the uterus and ensuring that it is oriented to the frontal plane of the body, with the seal valve oriented at 3 or 9 o'clock. Ultrasound may be used to confirm proper placement of the intrauterine loop within the uterus. After insertion, confirm that the intrauterine loop is entirely within the uterus and the cervical seal is at the external cervical os. Attach the pre-filled syringe to the seal port and fill the cervical seal with 60 milliliters of sterile fluid. Up to 60 milliliters of additional sterile fluid may be added if needed to achieve coverage of the external cervical os and create a vacuum seal. Set the vacuum source to 80 millimeters of mercury while occluding the end of the tubing to verify vacuum level. Vacuum tubing is connected to JADA, initiating therapy. Evacuation of blood into the vacuum tubing and canister should follow. Confirm that the cervical seal is positioned at the external cervical os after JADA is in place. You may need to reposition JADA if required to improve the seal. Tape JADA to the patient's inner thigh without tension. In the pivotal clinical study, uterine collapse was observed in a median of 1 minute. In a C-section, if the abdomen is still open, visually confirm uterine collapse and change in tone. Blood flow may continue for a few minutes after uterine collapse. After initial evacuation of any pooled blood, presentation may vary during treatment. Additional blood moving into the tubing or accumulation of the blood in the canister may be observed, or there may be no further blood evacuation. Leave JADA in place with vacuum applied until bleeding is controlled for at least 1 hour. The uterus should be firm and the patient stable. Verify that the treatment is no longer needed before disconnecting the vacuum from JADA. Disconnect the vacuum tubing from JADA while the vacuum is on to collect any blood from the tubing into the canister and document median evacuated blood measured in the canister. Attach an empty syringe to the seal valve and remove all fluid from the cervical seal. Keep JADA in place for at least 30 minutes and monitor for any recurring uterine bleeding before removal. Reinitiate vacuum treatment as needed. If bleeding remains controlled and the uterus is firm for a minimum of 30 minutes, JADA may be removed. Place one hand on the abdomen to secure the uterine fundus, while the other hand slowly withdraws JADA. If bleeding is not controlled rapidly, assess for other sources of bleeding and consider alternate treatments. The JADA system is a fast, definitive, and physiologic approach to treatment for abnormal postpartum uterine bleeding or hemorrhage.